yes, we have treatment, and that's why it's a control program. Initially, like in 1986 when it started, there was nothing like treatment, and that's why we had a lot of people dying to HIV. Then I remember there was this popular Afrobeat singer that also died. As a matter of fact, it was the one that brought the support we have in the program, because the brother was the then minister, Fela Anikulapo Kuti. He died of AIDS. He died of HIV. So we have treatment now, and the treatments are readily available. Presently in Ondo State, we have over 22,000 people living with HIV that are on treatments. Yeah, we have cases of people being on treatment and being lost to follow up. After a while, they get tired. It's usually not easy taking drugs continuously for life. So we have a mechanism whereby we track such patients. As long as we have enrolled you and you have started treatment, we follow you up continuously, such that you miss a clinic, we are calling you up, we are tracking you to ensure that these drugs are given to you. As a matter of fact, we also have some form of services we offer in the community, taking drugs to people that cannot come to the facility, because these drugs are not something you start and stop halfway. It's going to be worse off. And you know why I said it's going to be worse off? There's something called mutation. The virus that is multiplying in the body, when it sees that, you started something, it withdraws, because the drug will start killing the virus and it will reduce the viral load. Now, by the time such person stops taking the drug, what happens is that the virus will now mutate, change into a different strain, that the drug, if the person wants to restart, it might not work for the person. That's the danger. And that's why sometimes you see some patients then change from first-line drug to second-line drug. There's also a salvage regimen. We don't have salvage regimen in Nigeria. And the higher you go with the first-line, second-line salvage regimen, which is the third-line drug, the more expensive it becomes. So as much as possible, we want most of our patients to be on the first-line regimen. So these drugs are available across all 18 local government areas in Ondo State. We have treatment facilities across all the local government areas in Ondo State. I think we have about 32 treatment sites as we speak, so that people can access. Yes, we know it doesn't look like the coverage is so good, but we're making do with that, and we ensure that, like I mentioned earlier on, we track our patients. For patients that cannot come to the clinic, perhaps because of distance or poor accessibility to the clinic, we take their drugs to them to offer some of community services, as long as they are adherent to their drugs. As long as they keep taking it and they don't, miss out on the drug. Yeah.
So they can still
they live a quality and productive life. Up till now, up till as I speak, treatment is free for everybody. Every testing is free, treatment is free. The only thing is, if an opportunistic infection comes up, there's not so much support for some OIs. In those days, when the program was still very robust, all of the OIs were covered, all of the laboratory investigations were covered. But now there's been lots of cuts in funding, so there's been lots of constriction and reduced support for the program. But drugs are still very much available free. The HIV testing itself are free, but some investigations are not covered. Like a patient that wants to do A&U creatinine, we might have to pay for that. Our people will say that but I think I beg to differ in that, because sometimes when you know about something, it helps you take the right step earlier. So what I would advise, get tested. If there is anything there, if you are positive, we have treatment. Okay, don't let me call it treatment now. We have management. We have something to manage you, and for now it's still free. So why would I say it's better I don't get tested because I don't want to know whether it is there? It's better you know, rather than wait until the point where it becomes AIDS defining. So the first advice I would give to anyone is go out there, get yourself screened. Know the status of your body. Know what is happening in your body. You can go to the clinic today, you run all of the tests, and you might not even find HIV. What if you are finding cancer? Most of these things are similar. And I tell people, HIV is much better than having a cancer. But I tell you HIV is better. Reason being that there is support for HIV. Anybody diagnosed with cancer today is on their own, except we have some NGOs, which are very few. Cancer management is still very expensive. So you're going to the clinic to get screened might help you avoid future dangers. So you get screened today, even if it's not HIV and something else is picked. The fact that it is picked early, it is attended to early. and by that the person can live. So as people, we need to have better health seeking behavior. We need to get screened. We need to prevent ourselves as much as possible. I think I left out something on occupational exposures. There are some people that got HIV through needle pricks in the hospital. A laboratory scientist or a doctor trying to treat a positive patient, or not even aware of the patient's status, and pricked him or herself and didn't attend to it. There's something we call PEP, that's post-exposure prophylaxis. The prophylaxis is for this category of people to prevent them from contacting it. So anybody in the clinic that has a needle prick or maybe a splash in the course of surgery, please go out there, get tested. The first thing is, before we place you on PEP, we test you to ensure that you are not even living with it without knowing first, because there's no point taking PEP for anyone that is that had an occupational exposure or a rape. One of the things is also an intervention for people that come into that were raped. We test them for HIV. If they are not positive, then we place them on PEP to prevent them. Perhaps the person was still in the window period. The person that forcefully raped them or assaulted them was still in the window period. Also, we have another form of prevention we call PrEP. That's the pre-exposure prophylaxis. This is usually used by discordant couples. The people we refer to as discordant couples are those people that maybe one of the spouses is positive and the other is negative, and they have chosen to leave and marry.